The Trump administration is changing some things about the COVID vaccine. Now, I've got a news clip here so you can actually hear from a doctor. You don't have to worry about the redneck person talking about the medical stuff. Yeah, I don't even trust myself on listening to myself on medical stuff. So, yeah, you don't have to worry about that. You ain't going to be hearing from me on the medical stuff. I'm just bringing it up for the simple fact of that I keep hearing, oh, healthy people should be taking it because well, here's my question. I keep hearing from medical professionals that, you know, COVID doesn't work. COVID vaccines don't work. They don't prevent you from catching it. They don't prevent you from keeling over because of it. It doesn't really prevent anything. Um, People keep saying, "Well, it's tested and no, it's not. Most of the medications out there are supposed to have long term and for years. This was rolled out in like that. So let's let you hear the doctor talking about this.
Howdy, y'all. This is Paul, the Redneck Thinker. What we have here is a channel to communicate. I want you folks to be thinking by the time you leave my videos. Why? Because I'm tired of people talking via what other people tell them to think. So, watch my video and enjoy the chance to think for yourself.
U.S. regulators say annual COVID-19 shots for healthy younger adults and children will no longer be routinely approved. It comes as the FDA sets new guidelines based on a patient's risk of getting severely sick from COVID-19. ABC's medical correspondent, Dr. Darian Sutton, is joining me now for the checkup. Great to see you.
Great to see you as
live
well.
and in person. So how significant is this news, and what does it mean for most healthy people who may contract COVID-19?
You know, for the biggest, the big picture here, when you look at it as a person just thinking about getting your COVID vaccine, this likely won't change much in your everyday experience. But what's important to understand is that this is a policy shift focusing on those who are higher risk. For example, those over the age of 65 or those with an underlying health condition. This is in line actually with what we're seeing a movement around the world, you know, in the UK as well as Australia. The question here and what's causing a conflicting opinion among scientists is how vaccines will be reviewed in the future. So previously, the FDA approved a vaccine if the manufacturer was able to show that there was a beneficial immune response compared to the year prior. That's actually how we approve flu vaccines. In this policy change, however, they're asking for something called placebo-controlled trials. Now, this is, as you said, to get a better understanding and the risk-benefit analysis for people who are otherwise young and healthy. The concern here from scientists where there's a conflicting opinion is that many are stating that that just simply takes more time on a vaccine that's already studied and can unfortunately limit access to those who are desiring it.
Bottom line, is the COVID-19 vaccine something that you would still recommend even healthy folks get year after year?
Absolutely. And the reason why I say that is because I think that let me give it a little bit more nuance. So absolutely for those who are higher risk, for example, my patients who are over the age of 65. And what people don't realize is that 3/4 of Americans have some level of an underlying condition or health condition they may not be aware of. So I think starting the conversation to make sure that you're not in that high risk group and then stepping down from that. Are you managing or taking care of an elderly family member? Do you have a child at home that has an immune compromised position? And these are reasons why people also should get vaccinated. But again, it starts with a conversation to make sure that you fully understand what's going on.
So, I've got my opinions. I have never taken a COVID shot day in my life. If I've caught COVID, okay, it's a hyper cold. That's all it is. Even with the medical issues that I've had over the years that COVID has been here, I'm still alive. I'm still kicking. I haven't had to be hospitalized. Um, so yeah, I'm not real worried about it. The few times I've ever taken a flu shot in my life, I got the flu. When I don't take the flu shot, I don't catch the flu. Seriously, that really has happened to me. If I get the flu shot, I get the flu. But I don't get it if I don't take it. So yeah, I'm not going to take COVID shot. They, if you want to take it, I'm not against you taking it. Go right ahead. It's, what it is. But what do you think of this? Do you think that what do you think about these changes? Let's just start the discussion. I could care less about the rest of it. Let's start the discussion. Do you think that this change is a good thing or not? And do you believe that you should take the COVID vaccine? Let's leave it at that. So, this has been Paul, the Redneck Thinker. Y'all have a good day now. Bye. So, folks, that's the story that I wanted to bring you on this video. And I just wanted to say thank you again for coming by. Hit like, subscribe, comment, all that fun stuff if you don't mind. Help me out. So, y'all have a good day now. Bye.